Permission, I will make a statement on our continuing fight against coronavirus and how we intend to fulfil our simultaneous objectives, saving lives, protecting the NHS, while keeping our children in school and our economy running, protecting jobs and livelihoods. This morning, the Deputy Chief Medical Officer set out the stark reality of the second wave of this virus. The number of cases has quadrupled in the last 3 weeks. There are now more people in hospital with COVID than when we went into lockdown on March the 23rd, and deaths are already rising. And of course, there are those who say that on that logic, we should go back into a full national lockdown of indefinite duration, closing schools and businesses, telling people again to stay at home, as we did in March, once again shattering our lives and our society. I do not believe that would be the right course. We would not only be depriving our children of their education, we would do such damage to our economy as to erode our long-term ability to fund the NHS and other crucial public services. And on the other side of the argument, there are those who think that the patience of the public is now exhausted, that we should abandon the fight against COVID, stand aside, let nature take her course, and call a halt to these repressions of liberty. And of course, I understand those emotions. I understand the frustration of those who've been chafing under the restrictions, the sacrifices they've made. But if we were to follow that course, Mr. Speaker, and let the virus rip, then the bleak mathematics dictate that we would suffer not only an intolerable death toll from COVID, we would put such a huge strain on our NHS with an uncontrolled second spike that our doctors and nurses would be simply unable to devote themselves to other treatments for cancer, for heart disease, and hundreds more that have already been delayed and that would be delayed again with serious long-term damage to the health of the nation. And I'm afraid it is no answer to say that we could let the virus take hold among the young and fit while shielding the elderly and vulnerable, because the virus would then spread with such velocity in the general population that there would be no way of stopping it from spreading among the elderly. And even if the virus is less lethal for the under 60s, there will still be many younger people for whom, alas, it remains lethal. So, Mr. Speaker, we don't want to go back to another national lockdown. We can't let the virus rip, and so we've followed since June a balanced approach with the support of many members across the House to keep the R down while keeping schools and the economy going, and controlling the virus by changing our behaviour so as to restrict its spread. That's why we have the rule of 6, and we have restrictions such as a 10 p.m. closing time on our hospitality sector. And, Mr. Speaker, I take no pleasure whatsoever in imposing restrictions on these businesses, many of which have gone to great lengths to reopen as safely as possible. Nor do I want to stop people enjoying themselves. But we must act to save lives. And the evidence shows that in changing our behaviour, in restricting transmission between us, our actions are saving lives. Left unchecked, each person with the virus will infect an average of between 2.7 and 3 others. But SAGE assess that the current R nationally is between 1.2 and 1.5. So we're already suppressing that R to well below its natural level, which is why the virus is not spreading as quickly as it did in March. But we need to go further. In recent months, we have worked with local leaders to counter local spikes with targeted restrictions. But this local approach has inevitably produced different sets of rules in different parts of the country that are now complex to understand and to enforce. So, just as we simplified our national rules with the rule of 6, we will now simplify and standardise our local rules by introducing a three-tiered system of local COVID alert levels in England, set at medium, high and very high. The medium alert level will cover most of the country, and will consist of the current national measures. This includes the rule of 6 and the closure of hospitality at 10 p.m. The high alert level reflects the interventions in many local areas at the moment. This primarily aims to reduce household-to-household transmission by preventing all mixing between different households or support bubbles indoors. In these areas, the rule of 6 will continue to apply outdoors, where it is harder for the virus to spread, in public spaces as well as private gardens. Most areas which are already subject to local restrictions will automatically move into the high alert level. As a result of rising infection rates, Nottinghamshire, East and West Cheshire and a small area of High Peak will also move into the high alert level. The very high alert level will apply where transmission rates are rising most rapidly and where the NHS could soon be under unbearable pressure without further restrictions. In these areas, the government will set a baseline of prohibiting social mixing indoors and in private gardens and, I'm sorry to say, closing pubs and bars. We want to create the maximum possible local consensus behind this more severe local action. So in each area, we will work with local government leaders on the additional measures which should be taken. This could lead to further restrictions on the hospitality, leisure, entertainment or personal care sectors. But retail, schools and universities will remain open. As my right honourable friend the Chancellor has set out, the government will expand its unprecedented economic support to assist those affected by these decisions, extending our job support scheme to cover 2/3 of the wages of those in any business that is required to close, and providing those businesses with a cash grant of up to £3,000 a month instead of £1,500 every 3 weeks. We will also provide local authorities across England with around £1 billion of new financial support on top of our £3.6 billion Towns Fund. And for very high areas, we will give further financial support for local test and trace and local enforcement, and assistance from the armed forces, not for enforcement, but rather to support local services, if desired, in the local area. Mr. Speaker, I can report that we've been able to reach agreement with leaders in Merseyside. Local authorities in the Liverpool City region will move into the very high alert level from Wednesday. In addition to the baseline I've outlined, this is as well as pubs and bars. In Merseyside, gyms and leisure centres, betting shops, adult gaming centres and casinos will also close. I'd like to put on record my thanks to Steve Rotherham and his colleagues for their cooperation in very difficult circumstances. Engagement with other leaders in the North West, the North East and Yorkshire and Humber is continuing. I know how difficult this is. They, like us, like everyone in this House, are grappling with very real dilemmas. But we cannot let the NHS fall over when lives are at stake. So let me repeat the offer that we're making to those local authorities. Work with us on these difficult but necessary measures in the areas that are rated very high in return for more support for local test and trace, more funding for local enforcement, the offer of help from the armed services and the job support scheme as announced by the Chancellor. I believe not to act would be unforgivable, so I hope that rapid progress can be made in the coming days. Regulations for all 3 COVID local alert levels are being laid today. They will be debated and voted on tomorrow before coming into force on Wednesday. We will also keep these measures under constant review, including a 4-week sunset clause for interventions in very high areas. A postcode search on gov.uk, as well as the NHS COVID-19 app, will show which local alert level applies in each area. And we're also publishing updated guidance to explain what the COVID alert levels mean for those who are clinically extremely vulnerable. And while these levels specifically apply to England, we continue to work closely with the devolved administrations to tackle this virus across the whole United Kingdom. Mr. Speaker, this is not how we want to live our lives, but this is the narrow path we have to tread between the social and economic trauma of a full lockdown and the massive human and indeed economic cost of an uncontained epidemic. With local and regional and national government coming together in a shared responsibility and a shared effort to deliver ever better testing and tracing, ever more efficient enforcement of the rules, and with ever improving therapies, with the mountains of PPE and the ventilators that we have stockpiled, with all the lessons we have learned in the last few months, we are becoming better and better at fighting this virus. And though I must warn the House again that the weeks and months ahead will continue to be difficult and will test the mettle of this country, I have no doubt at all that together we will succeed, and I commend this statement to the House.
I call the Leader of the Opposition, Keir Starmer.
Thank you, Mr. Speaker. Can I thank the Prime Minister for advance sight of his statement and for his telephone call earlier today. Mr. Speaker, we are at a critical moment, a tipping point, to quote the Deputy Chief Medical Officer. We have all seen the clear and alarming trend in infection rates. The virus is now spreading in all areas of the United Kingdom, though much faster in some areas than others. And as the Prime Minister said, and the Deputy Chief Medical Officer said, there are now more patients in hospital with COVID today than when the country went into lockdown on the 23rd of March, and deaths are rising. Nobody should be under any illusion about where this is heading or of the need for decisive action. The question today is whether the restrictions announced by the Prime Minister can bring the country back from the brink, whether they can regain control of the virus and provide the support and confidence that local businesses and communities need. That's how high the stakes now are. So we will consider the package, we will look at the small print of the Prime Minister's statement, we will discuss them with local mayors, councillors and leaders in the areas most affected, and we'll scrutinise the economic package that sits alongside them. But I have to say to the Prime Minister, I'm now deeply sceptical that the government has actually got a plan to get control of this virus, to protect jobs or regain public trust. We've tried to give the Prime Minister the benefit of the doubt, but it increasingly feels like the Prime Minister is several steps behind the curve and running to catch up with a virus that he has lost control of long ago. It was less than 3 weeks ago, 22nd of September, that the Prime Minister came to this House to announce new restrictions. He said then that the measures he was introducing then would, I quote, curb the number of daily infections, that those restrictions were carefully judged to achieve the maximum reduction in the R number. That hasn't happened. Those measures have not worked. We wouldn't be here today if they had. And there's a pattern here. On the 1st of July, the Prime Minister told us of his new whack-a-mole strategy to control local outbreaks. 20 areas have now been in restrictions for over 2 months. 19 have seen their infection rates rise, some by very large amounts. So those measures have not worked either. In May, the Prime Minister boasted of a world-beating track and trace system. He told us it would be a real game changer in the fight against the virus. We've debated this many times since, but last week the figures were the worst yet. The Prime Minister promised 100% of test results would be turned around in 24 hours, the latest figure, Mr Speaker, for in-person testing is just 24% being turned around in that period. This serial failure, combined with the repeated leaks and briefing to the newspapers in the last few days, have fatally eroded public confidence just when we need it most. So can the Prime Minister tell us, what reassurance can he give us that these measures today will be sufficient to get the virus under control? Will he finally accept that trace and isolate should be handed over to local authorities, as we've been saying for months? Will he accept that the support packages announced by the Chancellor simply won't work for many thousands of people, particularly those on the minimum wage? Mr Speaker, there's huge anger about this in areas under lockdown, and there's a huge gap in the government's plan. And will he confirm that mayors, local leaders, council leaders and others will be fully involved in any future decisions? Finally, I want to say this to the Prime Minister. I know that there will be some on his side who will oppose further restrictions. There will be those that will look at the data and tell him to disregard it, or say the cost of acting now is too high. I want to be clear. The worst thing the Prime Minister can do is not act quickly and decisively enough, or to keep coming back to this House every couple of weeks with a new plan that doesn't work and isn't up to the scale of the task. We need to break that cycle, finally get on top of the virus, rebuild public confidence. I hope the measures announced today will do so. But the House and the country will be deeply sceptical whether they can. Thank you, Mr Speaker.
Prime Minister.
Well, Mr Speaker, we've had a slight change of tack, in my view, from the right honourable gentleman who has hitherto been willing to support the measures that this government is putting in place to restrict the spread of coronavirus, and we now see an equivocation. He wants it both ways. He said he supported the rule of 6, Mr Speaker, and then his side refused to vote for it. He said he's unwilling to support the restrictions we've placed on hospitality. He continually runs down NHS tests and trace. What he won't say, Mr Speaker, is what he would do. And what he won't say is exactly how he would propose to get this virus down without those kinds of restrictions. If he supports the Tier 3 measures that Merseyside City Region have rightly put into place today, then he should say so today. He should have the guts to say so to local leaders across the country, that he supports those measures. He encourages them to go into Tier 3. I think it's a stunning silence that we've heard from the right honourable gentleman. We, by contrast, Mr Speaker, are working with those local leaders to put in the measures that will protect their populations, protect the NHS, keep our economy moving and drive the virus down. That is our collective endeavour, and I strongly urge him to work out where he stands, to stop flip-flopping from one side to the next, or rather to go back to his previous position, which was support for restrictive measures where necessary to drive the virus down.
Ian Duncan-Smith.
Mr Speaker, can I welcome my right honourable friend's statement and recognise that these are difficult times and my right honourable friend has to make very difficult and, I hope, balanced choices, balancing the economic damage against the need to save our fellow citizens. But in all of this, there is one positive point that's come out, which is rarely referred to, and that is that the death rate at the moment has fallen from 3% in June to 0.6%, which has to be seen as possibly part of what the government is trying to do. And given that, so the strategy of the government is, therefore, to drive down the infection rate, quite legitimately, I understand that, while searching for a vaccine. I just simply want to raise with my honourable friend that others have said, and the scientific advisors have said as well, that there's a lot of talk at the moment about the antivirals, these two antivirals that have now arrived, remdesivir and ivermectin. And given the government's objective, therefore, to drive the infection rate, also underneath that, surely, given the age of death at the moment averaging 82.4, shouldn't we now make these antivirals much more widely available at the earliest opportunity through GPs and every other doctor to get them to those people to reduce the likelihood, A, of bringing themselves into hospital and then dying?
And just help with everybody, can we move short, punchy answers and questions? It'll help to get through everybody on this. Prime Minister.
Well, Mr Speaker, he's of course right that we have better treatments, but alas, the death rate has risen many times over just in the last few weeks, 6 times over just in the last few weeks, and we have no choice under these circumstances, with more people being admitted into hospital every day, to get the virus down.
To Scotland with the leader of the SNP, Ian Blackford. Ian Blackford.
Thank you, Mr. Speaker. Over recent weeks, we've all witnessed the worrying trends of infection, the upsurge in hospitalisations, and sadly the increase in death. The danger of the virus is self-evident. We know that we are at a tipping point. So today must be a turning point. A turning point when we must once again act collectively and get back to the absolute priority of suppressing the virus, protecting the NHS and saving lives. So can I ask the Prime Minister, is the policy to bring the R rate below 1 through the highest level interventions being proposed? Mr. Speaker, since the beginning, we've known that mass testing is vital. Any delays in the processing of tests slow the start of contact tracing. Can the Prime Minister advise what proportion of tests in the last 7 days took longer than 48 hours to process? And what steps are being taken to ensure there is no backlog in processing from the Lighthouse labs? Mr. Speaker, if today is to be a turning point, then the UK government needs to carry out another U-turn on financial support for workers. It is blindingly and blatantly unfair. Just as health restrictions are being strengthened, economic support is being weakened. The Chancellor needs to finally wake up to that logic. No more last-minute half-baked economic announcements. Even Tory-backed in the north of England are calling for furlough to be maintained at 80% of wage support. Will the Prime Minister give some certainty and security to businesses and workers? Will he finally instruct his Chancellor to extend the full furlough scheme beyond October? Businesses and workers must not pay the price for managing the lockdown with closures and unemployment when their businesses would be viable post these special measures. Can the Prime Minister also confirm that devolved administrations will be able to trigger the financial support directly without requiring approval from the UK government when they choose to be an area under restrictions to help reduce the spread of the virus? And finally, on universal credit and support for the most vulnerable. Mr. Speaker, last Wednesday, Prime Minister's question, the Prime Minister suggested I ask him again on his government's plan to maintain the lifeline of the uplift in universal credit support. So now that he has had another week to consider it, will he do the right thing and make the £20 universal credit uplift permanent?
Thank you. Well, Mr. Speaker, on NHS test and trace, capacity has massively increased, and as he knows, to 312,000. He asked what steps we're taking. We're introducing new testing sites. I think 500 new testing sites. We're introducing more labs for testing, and he asked also about what we can do to get the virus down, and the measures that we're taking, Mr. Speaker. And he's completely right that it depends on enforcement, it depends on testing and tracing, Mr. Speaker, but it also depends on each and every one of us following the guidance, working together to get the virus down, and that is what I hope that he will encourage everyone to do. On the excellent point that he raises about support for businesses that are going to be affected by the latest measures, I would just stress that the Chancellor's latest job support scheme at 67% is highly competitive with all other European countries, indeed more generous than many, and we will continue to put our arms around every worker and every business in this country to the best of the ability of this country. And on his specific point about universal credit, the uplift will remain present for the rest of this financial year, Mr. Speaker.
Just help the House. I'm going to finish this at 5:50, so let's help each other. Jeremy Hunt.
Mr. Speaker, this morning it was announced that the routine testing of asymptomatic NHS staff in hotspot areas would start. This has been long advocated by the Select Committee, and I want to thank the Prime Minister for progress in this area. We all want to avoid a second national lockdown, which would be devastating for jobs. Does my right honourable friend agree that the evidence from China, Korea and Italy is that the best way to avoid this is earlier, decisive, localised interventions, however difficult, however unpalatable, and that today's difficult decision is not, therefore, about a trade-off between jobs and health, but ultimately the best way to secure both.
Well, my right honourable friend is absolutely right in what he says, and I know that local leaders across the country will listen to him, and I hope that they will accept our offer and go into Tier 3 where necessary.
Ed Davey.
The government has asked a lot from people during this pandemic. Stay at home, close your business, don't be there at the death of a loved one. The British people have borne such sacrifice with grace and resilience. All they ask in return from government is clear communication and basic competence. Yet it seems, Mr. Speaker, their sacrifices have been squandered by the government's failure to build a robust test, trace and isolate system, or even communicate competently. So can the Prime Minister promise that the new sacrifices he's asking from people today will not be squandered this time?
Well, Mr. Speaker, of course we're working hard with colleagues across the House to get our messages across, and I'm grateful to him for the support he has felt able to give for the measures that we've outlined. I do believe that they can be very effective if they're delivered jointly with local authorities, with local support. And that's what we're working for, and I hope that he will join us in that effort.
Kate Griffiths.
Thank you, Mr. Speaker. I know pubs across Burton and Uttoxeter will appreciate the support available to them through the Jobs Support Scheme in the event of a local lockdown. But will my right honourable friend consider the impact on breweries, for example, which won't be eligible for the support but will have no pubs to be able to sell to?
Well, Mr. Speaker, I understand the point that she makes, and we will have, of course, the regular job support scheme available to businesses that are open but not able to trade in the way that they would want to.
Sir Geoffrey Donaldson.
Thank you, Mr. Speaker. We must, of course, do all we can to ensure that the NHS is able to cope with the current situation. But I agree with the Prime Minister that a localised approach is the right approach, whilst keeping schools and businesses open. But in terms of support for those who have so far not received that support, will the Prime Minister commit to putting his arms around those people who have not yet benefited from the various schemes that have been brought forward by the government?
Well, Mr. Speaker, we always do what we can to improve the welfare system and those who aren't benefiting, but I would just remind the House that the self-employed, which is a group that I think we all care about very much, have received so far £13.5 billion of support, and will continue to look after them as well.
Liv Davies.
One of the many reasons the Prime Minister has proved himself such a formidable and popular politician over so many years has been his resolute belief in the common sense of the British people. Therefore, instead of a constant blizzard of arbitrary rules which will only serve to collapse the economy and destroy businesses and jobs, will he instead remind people what's important: social distancing, washing hands, the groups who are most at risk, the elderly, people with health conditions, etc., and once again put his trust in the British people to act responsibly? After all, believing that individuals make better decisions for themselves, their families and their communities than the state can make for them is surely at the heart of what it means to be a Conservative.
Well, Mr. Speaker, he is exactly right, and the best decision that individuals can make for themselves, for their families and for communities is to follow the guidance: wash your hands, face, space, protect the NHS and save lives.
People from Conway, with 122 cases per 100,000, are not permitted by Welsh law to make non-essential journeys into Meirionydd next door, where cases stand at 18 per 100,000. But people in Liverpool, with almost 1,600 cases per 100,000, can still go on holiday in Gwynedd and Ynys Môn. People in Wales are asking the Prime Minister, how is this fair?
Well, Mr. Speaker, the guidance is very clear that people from very high areas, such as Merseyside, should not be making those journeys.
Is my right honourable friend aware that in Essex, though the case rate remains relatively low, we have cases doubling every 10 days. And isn't it better to bring in decisive measures which would be effective at suppressing the curve before it climbs, rather than waiting until after it climbs, provided the measures are effective and provided there's economic support, particularly for the hospitality sector?
My right honourable friend is completely right, and that's why we're bringing in the package that we are today.
Thank you, Mr. Speaker. So today we seem to have a partial admission of the failure of the government's outsourced test and trace system, when so many of us have argued for so long that it should be in the hands of public local health teams. Does he regret handing billions over to the private sector, who have failed so spectacularly? And will he now give it back to local public health teams who know their communities best, so that they can do that in all areas, not just the very high areas? And one final thing, Prime Minister, will he stop saying that he has put his arms around the self-employed, because over 3 million of them have had no support since March?
Well, Mr. Speaker, on her substantive, I repeat the point we've made about the self-employed. 13.5 billion have been given to support them, and where there's more that we can do, we will obviously look at it. She makes an interesting point about whether a local approach would have been better throughout this than a national approach. All the evidence is that you need both. And that's what we've supplied, and that's what we will continue to supply. And that's why we're expanding our support for the local approach, because all the experience of other countries shows you need a national approach, because otherwise the local test and trace operations simply do not join up, Mr. Speaker. And there are plenty of other countries where they've had that experience, and that's why we're going down an approach that joins up local test and trace with national test and trace as well.
What does he make of the Special Envoy's statement that we at the World Health Organization do not advocate lockdowns as the primary means of control for this virus?
I totally agree with what David Nabarro had to say. I think he's completely right. And I think that the best way of controlling this virus is commonsensical restrictions on person-to-person contact, because it's that person-to-person contact that spreads the virus, and that's what we all need to do.
Heading to North Down with Stephen Farry. Stephen Farry.
Thank you, Mr. Speaker. Northern Ireland is suffering from some of the worst COVID figures in the UK. Can the Prime Minister follow through on his commitment to give the Northern Ireland Executive the financial firepower so it can follow the science and do what is necessary to address a deteriorating situation, and to give businesses the support to do what's necessary?
Of course, Mr. Speaker, and the Northern Ireland businesses in Northern Ireland will receive exactly the same support, and on the basis of Barnett consequentials. That's inevitable.
Mr. Speaker, I welcome the Prime Minister's commitment to work on a local level, and I hope he'll understand my disappointment that Wolverhampton has been lumped into a Tier 2 system, despite the protestations of all 3 MPs and the local council. My fantastic pubs and restaurants have done everything asked of them, and now, because they're in Tier 2, they face no financial support at all and a devastating effect on their viability. Can he urgently look?
Well, Mr. Speaker, I'm grateful to my honourable friend, but actually the job support scheme is precisely available to pubs, restaurants, businesses in her constituency that are not able to trade that may be open but are not able to trade as they normally would.
Let's head up to Merseyside with Sir George Howard. Sir George.
Thank you, Mr. Speaker. The Prime Minister is aware that if we are to tackle these horrendous rises in COVID-19 in the Liverpool City region, we need a much more effective track, trace and isolate system, but we haven't got one yet. Will he accept my suggestion that we establish a Liverpool City region test, trace and isolate task force, including the NHS, local authorities, the Metro Mayor and other stakeholders, to report by the end of this week with suggestions as to how the unused NHS capacity that exists could be used more effectively, so that we have a proper test, trace and isolate system in place?
Yes. I'm grateful to the right honourable gentleman. I can tell him that we're already working with the Liverpool City region on improving local test and trace, and I think his suggestion is very apposite, and I'm sure is one that will be taken forward in the course of those conversations.
Mr. Speaker, we're seeing a very unwelcome trend from the party opposite that backs the government's sensible measures one week, only to flip-flop and change their mind the next week. Does my right honourable friend agree with me and several constituents from Derbyshire Dales who have said that what they want to see is this House working together for sensible policies rather than political point scoring?
Yes, indeed, Mr. Speaker, and I think what the people of this country want to see is unanimous support for measures that restrict the spread of the virus, and we've had that. We've had that before. I hope that we'll have it again, and what I hope is that members opposite who are calling on me to do more in Greater Manchester will prevail on the authorities in Greater Manchester to come into to Tier 3 and to help us to get there.
Mr. Speaker, tragically, one of the few certainties about this second wave is that economic hardship will rise. So why will the Prime Minister neither review the level of statutory sick pay, which even the Health Secretary said he couldn't afford to live on, or crucially extend the holiday hunger food voucher programme to cover half-term and Christmas holidays?
Well, Mr. Speaker, as he knows, we've given substantial sums to support meals for kids in need of free school meals in these difficult times, £380 million already, and we will continue through universal credit and other support to support families across this country throughout this crisis.
Thank you, Mr. Speaker. I warmly welcome my right honourable friend's collaborative approach with local government and with the mayors, but will he bear in mind that we have unity among the politicians and the public health experts across the West Midlands under our skillful and much respected Mayor Andy Street in support of the current levels of restrictions, because they do appear to be working. The medical evidence and political consensus suggests leaving the West Midlands at level 1 with the additional local restrictions.
Alas, the virus continues to rise across the country, not uniformly, but the judgments that we have made are ones that we're sticking to.
Thank you, Mr. Speaker. For the record, as you were well aware, Mr. Speaker, Halton is in Cheshire, although it's a member of the Liverpool City Regional Authority is actually in Cheshire. So can I ask the Prime Minister this? He or his ministers announced new measures, new restrictions on the 14th, the 22nd and the 24th of September, and as recently as the 3rd of October, either national or local, which impacted upon my constituency. Isn't this an example of how the government is shifting from one restriction to the next without any real proper plan to deal with this? So can I ask the Prime Minister one specific question about my constituency? Halton has a low rate of infection. There are a number of other areas that are not in the highest restriction rate. So can I ask him, why is Halton in the highest restriction rate when others are not?
Mr. Speaker, of course this government is obliged to adapt its plans to combat the virus as the epidemic changes shape and changes course. But our objective remains unchanged, which is to get the R down in his constituency and elsewhere, whilst keeping education open and keeping our economy going. And that's something I think on which both sides of this House are united.
Speaker, the Prime Minister has said there will be a 4-week sunset for areas in the highest restrictions. What reassurance can he give to areas in Tiers 1 and 2, some of which have had additional restrictions already for 2.5 months, that this isn't going to become a permanent state?
Mr. Speaker, we keep all these things under constant review, and nothing could be more attractive to the government than moving the whole country out of the present restrictions that we're in as fast as possible. That requires us all to follow the guidance.
Heading up to Scotland with Drew Hendry. Drew Hendry.
Thank you, Mr. Speaker. The Prime Minister has just said he wants to put his arms around every worker in the country. That'll sound pretty hollow to those people left alone and abandoned, those who've been excluded from any COVID support from his government. They now face a £20 a week reduction in their universal credit. So can you answer the question I'm asked by my increasingly desperate constituents every day. How are they to pay their bills?
Mr. Speaker, don't forget, I'm grateful on the round, but this government has increased universal credit by about £7 billion, perhaps £9 billion, £1,000 a year, and the uplift will remain in place for this financial year, as I told the House earlier on.
By when does my right honourable friend expect to have vaccinated the vulnerable population? What is his confidence in that date, and why does he have that confidence?
I'm grateful to my right honourable friend. Alas, I can't give him a date by which I can promise confidently that we will have a vaccine. There are some very hopeful signs, not least from the Oxford AstraZeneca trials that are being conducted. But as he knows, SARS was discovered, took place 18 years ago. We still don't have a vaccine for SARS. I don't wish to depress him, but we must be realistic about this. There's a good chance of a vaccine, but it cannot be taken for granted.
Don Butler.
Thank you, Mr. Deputy Speaker. Prime Minister... Sorry, Mr. Speaker. How dare I? My apologies. Prime Minister, instead of supporting established system in public health, you've invested £10 billion in privatised companies. It hasn't controlled the virus, it hasn't saved lives, and it hasn't rebuilt the economy. In Brent, wonderful CEO Caroline Downs, with the leader of the council, Mo Butt, had control of local testing. We were able to test people very quickly and surrounding areas. Now, the government has taken the majority of the testing away. People are told they have to travel miles to get tested. And in addition, care workers have waited 7 days to get their test results. When will the Prime Minister stop his obsession with the centralised approach and go for a decentralised approach that works?
I understand the point that she makes, and obviously, I'm sorry for the bad experiences that some people have had with excessive turnaround times for NHS test and trace and so on. But I do think that the mixed approach that we're taking is the right one. You need a joined-up national test and trace system combined with the work of local authorities, and that's what we're delivering.
Thank you, Mr. Speaker. I thank the Prime Minister for his statement and for the tireless work he's putting in to tackle this wretched virus. A number of constituents running hospitality businesses have contacted me, like Cheryl, who runs a station in Bishop Auckland, and she's particularly concerned about the lack of households being able to meet within her pub. So can the Prime Minister reassure Cheryl that we will look at lifting those local restrictions as soon as feasibly possible, and we'll also look at taking every step possible to provide additional financial support for those in Tier 2 lockdowns, please?
Of course, Mr. Speaker, and in addition to providing support for hospitality pubs in Bishop Auckland through the JSS that I've mentioned already, there's the business rate cut that she's familiar with, the grants that I've announced today. But the best thing, as she rightly says, is to get the virus under control so that we can lift these restrictions altogether. That's what we want to do.
Thank you very much indeed, Mr. Speaker. We all know that rising infections will mean more restrictions, but worried staff in viable businesses in Leeds want to know that they will be looked after if they are forced to close in future. Now, I presume the Prime Minister can give the House an assurance that the Council will be consulted before that happened. But for someone on the minimum wage who would lose a third of their income in those circumstances, and by the way, the French and German schemes are more generous than those applying here, can the Prime Minister assure my constituents that they will not, under any circumstances, be evicted from their homes because they could not afford to pay the rent?
Prime Minister. Well, Mr. Speaker, I must respectfully take issue with his characterisation of the scheme, which remains internationally competitive. In France, it's 60% for some, 70% for others. In Germany, it's about the same. In Italy, they have an 80% provision, but a serious cap. In Ireland, it's down, or a very low cap. In Ireland, it's down at 60%. This is a highly competitive scheme, and it's one that I think is generous by international comparisons. And on his point about evictions, of course, nobody wants to see anybody evicted because of the hardship they've suffered because of coronavirus, and that's why we've extended the period in which landlords are prevented from conducting such evictions by a further 6 months.
Rod.
Thank you, Mr. Speaker. Families across the country, in whichever of the new tiers, rely on childcare, whether formal or informal, Without it, key workers and those in the wider economy would be unable to work, and many children would be unable to get to and from school. Will my right honourable friend make sure that access to childcare, whether it's professional childcare or relatives and neighbours, remains available throughout this pandemic?
Yes, of course, Mr. Speaker, and I mean, he's totally right about, my honourable friend is totally right about the importance of childcare, and we remain committed to giving 30 hours of free childcare. But the crucial thing about our measures, Mr. Speaker, is to keep the economy moving as much as possible.
Sure.
In university cities like Exeter that have a COVID spike in student accommodation, but not yet significant community spread, but that nevertheless inflates our figures, what is his strategy for containing those spikes in student accommodation and preventing the need for lockdowns affecting the rest of the community?
Well, Mr. Speaker, I think that the differentiation that's often made between students and other members of the public is sometimes overdone. Students, I think, are playing a heroic role in containing the virus where they can, in following the guidance and not spreading it back into their families and their hometowns. I thank them very much for what they're doing, and I hope they continue in that way in Exeter and elsewhere.
Caroline Nelson.
Thank you, Mr. Speaker. I welcome my right honourable friend's decision to reject the twin dire choices of a second national lockdown and letting the virus rip, and I welcome the decision to take up the far more challenging, more complicated path of localising our actions to area. My constituency of Eastbourne is low incidence for the virus, but my hospitality sector is hard hit, and Christmas now is in the frame. So can I ask my right honourable friend what moves there might be going forward to hyper-localise actions and what support there will be for my constituents' jobs and businesses?
My honourable friend is absolutely right that it would be a wonderful thing if we could hyper-localise actions in the way that she suggests. Alas, the disease being what it is, you can't reduce the areas in which we place restrictions too small. But the best thing that her constituents can do, and the best thing the whole country can do, and to get through this as fast as possible, is to follow the package of measures that we've set out. And as I said to the right honourable lady opposite and to members opposite, the best thing would be if cities and regions across the country came together and delivered the package that we set out.
First.
Thank you, Mr. Speaker. Mr. Speaker, last week I asked the Secretary of State for Health whether he would fund local authorities in the North East who put forward a proposal for local test and trace services. The Secretary of State said, in response, we have put an extra £10 million into the local authorities in the North East to support contact tracing. Today I'm told in a telephone briefing that there is no money available. Which is it, Prime Minister? Can we fund the local authorities in the North East to contact that effective test and tracing?
Well, Mr. Speaker, I think she may have missed what I said. We're putting another £1 billion, or up to £1 billion, into supporting it, and I think supporting local authorities, and 500 million for supporting local test and trace and enforcement.
Jerome Mayu.
Mr. Speaker, whilst rightly moving to simplify the message, does my right honourable friend agree that flexible local approaches are the best way to tackle outbreaks, to prevent a total lockdown and minimise the wider economic impact, particularly on low incidence level areas such as Broadland?
Prime Minister.
That is exactly right, Mr. Speaker. That's the strategy that we've been pursuing for some time now, and that's why it's necessary to intensify the restrictions in some areas.
Mohammed Jas.
Thank you very much, Mr. Speaker. The Prime Minister keeps telling us that test and trace capacity is being increased. Yet the COVID-19 testing facility at Bedford Borough Hall has just reduced its service provision from 7 to 4 days a week at a time when infection rates are rising. So simple question, Prime Minister, why?
Prime Minister.
Mr. Speaker, I'd be happy to write to him about the test centre that he mentions, but as I told the right honourable gentleman opposite, we are increasing test and trace capacity and tests conducted the whole time, and across. as I said, be very happy to write to him about the particular case he mentions. But it is still the case, Mr. Speaker, that this country continues to test more people and conduct more tests than any other country in Europe.
Thank you very much, Mr. Speaker. The decision to place Cheshire in Tier 2 and the additional restrictions that will entail will inevitably impact on families and businesses right across Eddisbury, not least the already decimated wedding industry and its existing supply chain. So will my right honourable friend look again at what further targeted support can be made available for that industry, where it's going to struggle to remain viable through another 6 months of effectively being closed?
Prime Minister.
Well, Mr. Speaker, I have real sympathy for those in the weddings industry who have been affected. It's a great industry, and their times are very tough for them. That's why we're putting in the job support scheme that we are. That's why we're putting in the extra grants now for businesses. The best way forward is for us to get the virus down, get the spread down, so that we can reopen all those types of businesses as fast as possible.
Let's head to Scotland with Gavin Newlands. Gavin Newlands.
Thank you, Mr. Speaker. Many of my constituents support COVID-19 public health measures, but feel that this government, despite its rhetoric, hasn't reciprocated. If it's not the 3 million excluded from support, it's those on universal credit who lose their £20 weekly top-up, or those on legacy benefits who receive nothing, or Erskine hotel staff who missed out on follow because their payroll was run one day after an arbitrary and retrospective date. He's boasted about putting his arms around people, but is it not time to show people he has a heart?
Minister.
Well, Mr. Speaker, I must repeat what I said to the honourable gentleman, which is that this government has, by other global standards, done a huge amount, 190 billion already, to support people, businesses, jobs, livelihoods across the country. And on his specific point about universal credit, Mr. Speaker, we've increased the value by £1,000, and it will remain in place for the rest of this financial year.
Sent to North Devon with Slane Saxby. Slane Saxby.
Thank you, Mr. Speaker. Will my right honourable friend join me in thanking Devon County Council and Public Health Devon for their response to the virus so far, where swathes of local actions are in place to contain local outbreaks? And does he agree with me that it is vital national and local government works together in order to tackle the differences in regional prevalence of this virus?
Prime Minister.
Yes, and I thank her very much, and I thank everybody in Devon and local authorities in Devon for the efforts that they're making to keep this virus down. All I can say, Mr. Speaker, is that this is a giant collective effort. Alas, even in the southwest, we're seeing the virus going up, nothing like as much as in other parts of the country, but it is going up across the whole of the country, and we must work together to get it down.
Jones.
The Prime Minister says that he's listening and working with local authorities, but Prime Minister, that simply is not true. Since the beginning of this crisis, local authorities, Directors of Public Health, have been arguing for a locally based test and trace system. So when will he admit that his national approach, national system, has failed? And will he hand over to local authorities and Directors of Public Health the responsibility and resources for ensuring we have effective local test and tracing? Because that's the only way we're going to get on top of this crisis, Prime Minister.
Prime Minister.
Well, Mr. Speaker, I think I've answered that point about 4 times already, which is that you need a combination of both national and local.
Miriam Kate.
Thank you, Mr. Speaker. Parents in my constituency of Penistone and Stocksbridge rely on friends and family for informal childcare, and I believe that even under the new 3-tier restrictions, informal pre-arranged childcare can continue. But as a new parent himself, I'm sure my right honourable friend understands that sometimes circumstances dictate that parents need emergency childcare, and that's happening more and more with childminders having to isolate nursery staff, etc. So can he confirm that emergency informal childcare will still be able to assist parents even under the 3-tier system?
Prime Minister.
Tell me about it, Mr. Speaker. I think she makes a very, very important point, and the provisions we have for 30 hours of free childcare are obviously there, but her point about emergency childcare is well made, and that's why we need to keep the economy moving in the way that we are.
Neil Coyle.
Thank you, Mr. Speaker. The chief execs of 17,000 hospitality businesses, representing 500,000 jobs and millions of customers every week, including many in my central London Southwark constituency, say not one of them has seen a super spreader incident and none have had direct contact from the tracing system. We know testing and tracing isn't working, so why won't the Prime Minister get a grip and fix those systems instead of floundering, trying to find someone else to blame and putting more lives and more jobs at risk?
Minister.
I'm sorry, Mr. Speaker. That's why we're investing massively in NHS test and trace and in a coordinated local effort. And as I've said before, Mr. Speaker, we're now testing more people than any other country in Europe. And we've contacted hundreds of thousands of people across this country, persuaded them to slow the spread of the virus. And that is, I think, rather than continually knocking NHS test and trace, let's work together. Let's work together to support it and build public confidence.
Mr. Speaker, the Prime Minister and this government have been faced with a crisis the like of which we have not seen since World War II. Despite everything, they've kept our NHS safe, casualties to a minimum, and the economy continues to function. Will the Prime Minister 100% commit to my constituents on Arnis Morn to do everything that he can to prevent a second UK-wide lockdown, and join me in thanking them for their incredible effort in keeping our island's infection rates down?
Prime Minister.
I thoroughly congratulate the people of Arnis Morn for what they're doing, for the way they're keeping the infection rates down, and I hope that they will continue to work with the rest of the country to follow the guidance, save lives.
Prime Minister, thousands of women are not only carrying the anxiety of bringing new life into this world in the middle of a pandemic, but of having potentially to go into labour alone. And despite changes to the government's guidelines, too few hospitals are allowing women to take a birth partner into hospital with them. As somebody who experienced very painful and long labours, I cannot bear the idea of a woman facing that alone. So will the Prime Minister do what he can so that we don't look back in shame on how we treated pregnant women and new mothers during this period, and do what he can to make sure hospitals can do their bit to make sure women don't face this alone?
Well, Mr. Speaker, I thank her and I wholly share her feelings about the vital importance of allowing women to have a birth partner during labour. We have changed the guidelines, as she rightly says, to make that possible. But if she has particular cases in mind where it isn't happening, then I'd be very grateful if she would write to me with those details.
Thank you, Mr. Speaker. The government has quite rightly focused on protecting the NHS, but we also need to keep the NHS serving patients. In South Cambridgeshire, like other parts of the country, have got relatively low levels of COVID, but we've got plenty of people with other medical conditions that need planned as well as emergency care. As the second wave strikes, can the Prime Minister tell me what steps the government is taking to make sure that all patients, whatever their conditions, can carry on getting the treatment that they need?
Minister. Mr. Speaker, my honourable friend is spot on, and that's why it's so important to avoid an uncontained second wave in order to protect the NHS and allow those treatments and those therapies for other non-COVID afflictions to continue.
Thank you, Mr. Speaker. Just a month ago, the Prime Minister described his moonshot plan where there were going to be millions of tests done and returned every day. And he said if everything comes together, it may be possible even for sectors like theatres to have life much closer to normal before Christmas. Families now are feeling like a normal Christmas is going to be further away from ever, and local health officials in our area have said people are waiting 6 days, not a day, to get their test results. If we come back from the moon and get back to what's happening on planet Earth, when will he have enough testing capacity in place so my constituents can get their results in 24 hours?
Prime Minister.
Mr. Speaker, I can tell her that the daily test process has gone up just in the last month by 34%, and daily capacity has gone up 28%. And as she knows, by the end of this month, NHS Test and Trace are confident they will be doing 500,000 tests a day. They will have capacity, I should say, for 500,000 tests a day.
Harry Baldwin.
Thank you, Mr. Speaker. And no one envies the Prime Minister having to make these incredibly difficult decisions. Last week's ONS community survey showed that by far and away the biggest age group catching the virus at the moment is in the student age group. And I wondered, since age is a much bigger predictor of risk than geography, if his advisers are also considering making recommendations of how individuals can control their own individual risk by age.
Prime Minister.
Well, Mr. Speaker, one of the difficulties that we have, I tried to address this point in my remarks earlier, Mr. Speaker. One of the difficulties is that particularly with the large numbers of multi-generational households such as we have in this country, it is very difficult to confine the virus to one age group and one generation. And alas, as we're seeing now in the Merseyside region, one of the reasons we're so concerned is that it is starting to spread quite substantially amongst the over 60s.
Heading to Lucian with Vicky Foxcroft. Vicky Foxcroft.
Thank you, Mr. Speaker. Prime Minister, disabled people have felt like an afterthought throughout this pandemic. And I'd like to ask just one simple question, which requires only a yes or no answer. Will there be a sign language interpreter at your press conference this evening?
Prime Minister.
Mr. Speaker, I doubt that we will get one in time, but the point is registered.
Kevin Holloway.
Thank you, Mr. Speaker. From what the Prime Minister has said, I think I worked out that the entirety of Thirsk and Malton is in the lowest tier for risk, and I'm very keen to keep it there. Now that we have data at superlocal, can we have restrictions that are superlocal? So rather than even looking at things at a county-wide level of North Yorkshire, where we see varying levels of incidence, can we look at district council level, councils like Hambleton and Rydale, which have very low levels of transmission?
Prime Minister.
I hear my honourable friend, and I understand the point he makes. Alas, as I said earlier on, micro control of this virus is really very difficult without restricting people's freedom of movement, that I think would be in such a way as to be very difficult for people in Yorkshire.
45 withdrawn. Andrew Bauer.
Much, Mr. Speaker. It was very welcome earlier on today to hear the First Minister of Scotland confirm that the three-tiered system being unveiled in Scotland in a few weeks will closely align to that for the rest of the United Kingdom, because consistency of messaging is key when it comes to saving lives. With that in mind, will the Prime Minister confirm that the four-nation whole UK approach remains at the heart of what this government is trying to achieve in combating coronavirus?
Prime Minister.
Yes, and I thank my honourable friend for what he does to make sure that that happens, and actually the ways in which we cooperate are much more significant, Mr. Speaker, than the differences between us.
Heading to Swansea with Geraint Davis. Geraint Davis.
Mr. Speaker, will the Prime Minister confirm that those people who can work from home should work from home, and therefore will he reinstate the digital democracy in this Parliament that allowed MPs to participate in debates and ask questions who are self-isolating or shielding, so that they don't risk infecting other people as they travel to work, infecting others at work, or being infected themselves?
Minister.
Well, Mr. Speaker, in this matter, I think I'm going to defer to you and to the House authorities.
Anderson.
Thank you, Mr. Speaker. My constituents in Ashford have worked incredibly hard to obey all the rules and guidelines to keep COVID at bay. Therefore, I am deeply disappointed that we have found ourselves in the same lockdown situation as Nottingham, where rates are 8 times higher. We are not in Tier 3, which were my first fears, but this is not a fair reward to my constituents, so could my right honourable friend please assure me that our rates will be reviewed on a weekly basis, and when they come down, we will be taken out of Tier 2.
Prime Minister.
Well, I thank him for representing his constituencies well in the way that he does, and we will do. Of course, we will make sure that we review the measures for his constituency, as indeed for every constituency in this country, on a regular basis.
Thank you, Mr. Speaker. The only thing that's well beaten about the Prime Minister's track and trace system is its capacity to take taxpayers' money and put it in the hands of Tory party friends and deliver a chaotic system. Contrast that with the performance of local government, which has performed miracles at local level whilst being starved of resources by the government, who promised money and then reneged on that promise. Will he now provide the resources for local government if he's going to give them an extra responsibility in delivering track and trace?
Prime Minister.
Well, Mr. Speaker, I note the ideological scorn of any private sector work, which I thought had left the Labour Party these days, but doesn't seem to. Just remind him that we are. I share his veneration of local authorities as a creature of local government myself, and that's why we've given an extra 3.7 billion to support local authorities in this crisis, and as I told the House just now, $1 billion more to come.
Davies.
Thank you, Mr. Speaker. Lincolnshire is a vast rural county with many large towns. Can the Prime Minister assure me that any future restrictions and measures imposed on my county will be as targeted as possible and be made together with the Lincolnshire County Council leadership?
Mr. Speaker, it's the burden of what I'm saying today, that we want to do everything in cooperation with local leaders and local authorities.
Mr. Gordon.
Thank you, Mr. Speaker. Football clubs like Newport County AFC, like many industries, have been hard hit by the pandemic and really need to see the Premier League stick to their obligations to provide assistance to lower division clubs. Can the Prime Minister make sure this happens?
Yes, indeed, Mr. Speaker, I will.
Richard Holden.
Mr. Speaker, I'd like to thank the Prime Minister and Chancellor for the £200 billion they've already put in to support employers and employees in my constituency. But North West Durham constituents in events and hospitality are under severe pressure at the moment, with the restrictions already hammering their bottom line. In County Durham, what support is available for businesses, and does the Prime Minister know when the negotiations on whether we're going to be in Tier 3 or Tier 2 will be determined with local authorities?
Prime Minister.
Mr. Speaker, he should look for the implications for his constituency. He should, of course, look at the Gov.uk website. But be in no doubt that this government is committed to supporting businesses, jobs, livelihoods across the country. That's why my right honourable friend the Chancellor unveiled the job support scheme, and why we've uprated universal credit and put in the many other measures that we have, including cuts in VAT and business rates that will continue for a long time to come.
Samuel Wilson.
Thank you, Mr. Speaker. The Prime Minister has a difficult task leading the country through this health crisis, and it shouldn't be used to score political points in the way it has been by some today. However, does he recognise the real concern that there is, even amongst many of his own party supporters, at the impact of the policies which have been followed, and also questioning the effectiveness of those policies, because we're back now today where we were in March of this year? And what assessment has he made of the policies announced today on the forced closure of businesses, on jobs, business bankruptcies, on the long-term health of people and increased levels of poverty?
Well, Mr. Speaker, with respect to the honourable gentleman, we aren't back there where we were in March, because the R isn't at those levels, and we aren't going back to a national lockdown of the kind that we saw in March. What we're doing is a series of carefully modulated local and national measures designed together to get the R down, keep education going, keep the economy moving.
Thank you, Bassett.
Thank you, Mr. Speaker. My constituents in Meriden have worked really hard to comply with the guidelines, and I'm sure they'll adapt to this new tier system to protect the NHS and keep the rate of infection low. But because they've worked so hard, will the Prime Minister commit to working to review and get them out of Tier 2 as soon as possible, because they'll be doing their part and they deserve this?
Well, yes, I'm aware of the feelings in the Midlands and indeed around the country, and I can tell the people of Meriden that, of course, we want to get them out of any kind of restrictions as fast as we possibly can.
And then up to Scotland with Christine Jardine. Christine Jardine.
Thank you, Mr. Speaker. Prime Minister, we're all disappointed and distressed that we are back where we were in March in many ways. You say that Prime Minister says he wants to keep the economy going, but for many people, many businesses and individuals, particularly the clinically vulnerable, that will be impossible. So will the Prime Minister and the Chancellor end this chop and change, knee-jerk reaction approach we have seen in recent days and extend JRS and furlough into next June so that businesses and individuals can have the certainty and clarity of support that they will get, which will enable them to plan their way through this crisis?
Prime Minister.
Well, I understand the point that the Honourable Lady makes, but as she will also understand, the schemes that my right Honourable Friend the Chancellor has announced go on until next spring, and actually the original furlough scheme, don't forget, Mr. Speaker, has yet to elapse.
Jones.
Thank you, Mr. Speaker. The Nightingale Hospital in Harrogate has been stood up ready for full staff readiness. That 500-bed hospital was built in 18 days by 600 people, staff from the NHS, our armed services, Harrogate Borough Council and colleagues from the private sector. It was an example of local and national working together. Does he agree with me that that combination of local and national, public and private, is the way to bring all the resources we can to tackle this pandemic?
Minister.
Yes, indeed, Mr. Speaker, and I can assure the people of Harrogate and elsewhere that we are stepping up preparations across the country. But the Nightingales, I think Stephen Powers, the NHS, has confirmed the Nightingales are being stood up in the north of the country as well.
Toby Package.
Thank you, Mr. Speaker. The Prime Minister will be as aware as anyone that people don't generally go to the pub in order to meet their own wife. They will go to the pub to be with other people, and in the current programme that the Prime Minister has put together, there is no support there for those pubs. So he is saying that pubs, he will cover and support pubs that are forced to close, but many of those pubs will find their business model and their business is untenable. So will the Prime Minister do more to support those pubs that might be open but frankly are not able to make a living?
Well, Mr. Speaker, that's exactly why, on top of the low business rates, the VAT cuts and so on, and the grants that we've given, the job support scheme is directly designed to support those businesses which remain open, but which aren't able to, like pubs, but which aren't able to trade as they normally would under some of these restrictions. That's a fault.
Thank you, Mr. Speaker. Businesses in my central London constituency are hurting because of the low footfall, while of course we need to take appropriate measures to control the virus. Does my right honourable friend agree with me that we need to balance the interests of the economy, because it is only with a functioning economy that we can pay for our excellent NHS?
Prime Minister.
Well, my honourable friend is completely right, and that's why I made the point in almost identical terms earlier on.
Going up to Manchester Central with Lucy Powell. Lucy Powell.
Thank you very much, Mr. Speaker. Can I thank the Prime Minister for listening to calls from members from across Greater Manchester on both sides of the House to work with us locally to tackle the virus whilst remaining in Tier 2, which I think he's announced today. But does he agree with me that it's vital we take the public with us? And that means credibility, that the tough measures he's outlining really do follow the evidence of where transmission is occurring, because he's yet to provide evidence that closing pubs and restaurants would make a material difference in transmission, but action on households would. So will he today recommit to working with Greater Manchester leaders on tackling household transmissions, proposals that he's put forward to his office last night?
Minister.
Well, actually, the Deputy Chief Medical Officer, Jonathan Van Tam, addressed to that point directly earlier on today about transmission in hospitality settings. Clearly, we need to reduce the overall budget of transmission that's going on in the country, and that is one sector that we can address. I'm interested in what she says about Greater Manchester. My information is slightly different. What I would hope is that we can work together to bring down the rates in Greater Manchester, which at present are certainly worrying.
Butler.
Thank you, Mr. Speaker. Many businesses in Aylesbury are affected by the 10 p.m. curfew, despite the low infection rates locally. So can my right honourable friend confirm that there is and there always will be a scientific basis for restrictions on economic activity?
Prime Minister.
Yes, I can, Mr. Speaker.
Heading up to Gateshead with Ian Mearns. Ian Mearns.
Very grateful, Mr. Speaker. Mr. Speaker, would the Prime Minister confirm that the North East is at Tier 2? And can I recommend to the Prime Minister a document published this weekend by the Association of Directors of Public Health called Protecting Our Communities? This document suggests a comprehensive national strategy that embraces locally led responses. But in order for these local interventions to work, directors of public health and local authorities in the North East need the much heralded but as yet not forthcoming resources, so that with their local leadership working together with the communities they serve, we might have a real chance to turn back the tide of this virus. But we need the money, Mr. Speaker, real money, not promissory notes from the bank of empty rhetoric.
Prime Minister.
Mr. Speaker, I don't know whether £190 billion counts as a promissory note from or empty rhetoric, but that's what the Chancellor has provided so far in support, and I'm grateful for what he says about local responses. That is entirely right, and we're certainly looking for locally led responses to help us to get the virus down.
Jane Dant.
Thank you, Mr. Speaker. Could the Prime Minister say how we can use the three-tier system to enable all types of businesses to use a risk assessment base to their operation to help them to remain open and fully working in all but the very high-tier instances?
Well, Mr. Speaker, all businesses that are COVID secure should be able to keep going, and I hope that they will.
Heading to Scotland with Stuart C. MacDonald. Stuart C. MacDonald.
Thank you, Mr. Speaker. Will the Prime Minister look at the case of a young constituent of mine who has gone from a successful career in banking to facing the real prospect of bankruptcy, all because he set up his own business on the wrong side of the completely unnecessary cut-off date for self-employed support? He's used up his savings, he can't pay the bills. So will the Prime Minister act to close this significant gap in support for the newly self-employed?
Prime Minister.
Well, Mr. Speaker, we have to have some sort of cut-off date in order to deal with the possibility of fraud. I'm obviously very sympathetic to his constituent, and I wish him all the best. In the meantime, there is the support available under universal credit, but the best thing for his constituent and for the whole economy is to keep things moving and hope that he gets the kind of job that he wants as fast as possible.
Roberts.
Thank you, Mr. Speaker. In Delyn, which would likely fall into Tier 2 on the new scale, we've got draconian travel bans imposed by the Welsh Government, which means that people could go shopping 20 miles in one direction, but can't go half a mile in the other to visit family. This movement restriction makes a massive difference to business success, but Treasury support won't apply because they're not being mandated to close. Can my right honourable friend confirm that the virus doesn't respect county boundaries, and join me and my North Wales colleagues in calling on the Labour Government in Wales to publish their information and justify their decisions, as he does on a regular basis?
I certainly echo what he says about the government in Wales, and the businesses of the kind that he refers to in his constituency obviously have access to the job support system when they're forced to trade in a way that is not normal for them.
Henry McCarthy.
Thank you, Mr. Speaker. When my colleague from Newcastle upon Tyne North asked the Prime Minister about partners attending Labour, he said to her that if she had any problematic examples to bring them to his attention. Well, I have a constituent who has so far in her pregnancy lost 2 out of her 3 triplets, one at 8 weeks and one at 20 weeks. She was then told that she couldn't bring her partner with her to the 34-week scan. Now, obviously, scans ought to be good news for parents, but sometimes they are not. We had an intervention from the Mayor, we had support from Pregnant Then Screwed, the campaign group, and she was then allowed her partner to visit. But that is another issue. It's not just about attending Labour. Partner ought to be there for scans as well.
Prime Minister.
Well, I'm so sorry for the experience of her constituent, and she makes a very important point about partners being there for scans. I will look into the matter she raises.
Robin Miller.
Thank you. I welcome this government's approach to using health, economic and behavioural evidence in reaching its decisions, but a recent poll suggested that some 3/4 only of the people expected to isolate intended to do so, and that actually as little as 1 in 5 had actually done so. Does my right honourable friend agree that the key to tackling this pandemic is a shared responsibility, not just between national and local government, but also with every single citizen?
Prime Minister.
Indeed, Mr. Speaker, and everybody who's told to self-isolate because they've been in contact with somebody with an index case of COVID should remember that there's £500 to help them, but also a £10,000 fine if they fail to do so and therefore risk the virus spreading further.
Tim Johnson.
Thank you, Mr. Speaker. Liverpool will be placed on the highest of restrictions from Wednesday, with the closure of pubs, clubs, gyms and other leisure facilities for at least 4 weeks. Will the government stand by their commitment to safeguard businesses by properly compensating them, allowing them to survive the latest restrictions imposed on Liverpool City region and provide us with the necessary financial support to protect jobs and livelihoods?
Yes. Prime Minister.
Yes, indeed, Mr. Speaker, and that's why we've announced the measures today. Grants of up to £3,000 and the measures announced by my Honourable Friend the Chancellor, and the job support system designed to help people in exactly the circumstances she describes.
Mark Balsey.
Thank you, Mr. Speaker. I welcome the introduction of 3 tiers, which will give more certainty to everyone. But when hospitality outlets in Rugby have worked hard to make their premises safe and they've been supported by police, community wardens, bid rangers and street pastors, the 10 o'clock curfew has led to many leaving the pub to go to a shop to stock up with booze, often with their friends, to drink at home. If it is necessary to keep 10 o'clock, should off-licences be treated equally?
Prime Minister.
Well, Mr. Speaker, I understand the point that he makes about people's behaviour after leaving the pub, and that's why it's vital that everybody shows common sense and follows the guidance.
Lord Russell-Moyle.
Thank you, Mr. Speaker. You and I and the Prime Minister, you and I and the Prime Minister could live probably on a third pay cut on our pay. Someone on minimum wage with a third pay cut on their pay cannot live and pay the bills and therefore will be disincentivised from following the rules. Will the Prime Minister look again just for the minimum wage people to ensure there is a floor on the new scheme?
Prime Minister.
Yeah, I understand very much the point that he makes, and that's why we've extended the job support system, but also the universal credit system is there to provide a safety net and to help people precisely because as their incomes may go down, so universal credit goes up, and that's the point of the system.
Lawrence Robertson.
Thank you, Mr. Speaker. Every weekend in my constituency a large car boot sale takes place, which I've no objection to, but next weekend, just a few hundred yards down the road, Cheltenham races will be run without any paying spectators at all. Now surely that's an anomaly, and will the Prime Minister address this by allowing sporting venues to open to welcome paying spectators as long as they do so in a safe way?
Prime Minister.
Well, Mr. Speaker, we're generally disposed to any business or organisation that allows its activities to take place in a COVID-secure way. We will proceed with plans to do that for sporting events as soon as we possibly can. As for the car boot sale that he mentions in his constituency, I just urge everybody attending that sale to observe social distancing and stop the spread of the virus.
Heading up to Kingston-upon-Hull with Dame Diana Johnson. Dame Diana.
Thank you, Mr. Speaker. This morning, Professor Van Tam said that the resurgence in COVID-19 cases amongst young people is being spread to the older generation. And we know that the World Health Organization mantra is test, 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 but the test, trace and isolate system isn't good enough. So does the Prime Minister think that universities such as Hull University in my constituency should now set up their own testing facility for all their students, including asymptomatic students, just as UEA and Cambridge University are now doing?
Prime Minister.
Well, the Honourable Lady here, I believe, has mentioned this issue of Hull University's testing facilities before. Perhaps it was another Honourable Member, Mr. Speaker, but I will certainly find out what the obstacle is about Hull's testing facilities. There's no reason in principle why that university should not be testing in the way that the other universities she describes are doing.
Tobias Elwood.
Thank you, Mr. Speaker. Could I repeat Bournemouth University's offer to establish a testing lab on its campus so it can help the local community? In welcoming today's statement, the Prime Minister is well aware of the importance of the hospitality industry to the Bournemouth's economy. I'd be very grateful if he could review that 10 p.m. curfew as urgently as possible.
Prime Minister.
Well, I understand the point that he makes, and I have every sympathy with Bournemouth's hospitality industry, which I've enjoyed many times in the past, as I'm sure we all have. Mr. Speaker, alas, we have to make restrictions in the overall volume of transmission that's taking place in our society. That's an obvious place to make a difference. That's what we're doing.
Welcome back, Jim Shannon.
Thank you, Mr. Speaker. I'm glad to be back. My wife and I are still speaking after 2 weeks. If it had been a third week, it might have been a problem, but we're still together. Could the Prime Minister outline his discussions with the First Minister, and with special reference to proposed circuit breakers that some chief medical officers are calling for, acknowledging that these will only be successful if UK-wide and centrally funded, as there is simply no funding presently to allow businesses to continue to operate, if forced to close yet again, and particularly in areas such as my constituency of Strangford, which has the second lowest number of cases in the whole of Northern Ireland. Thank you.
Yes.
Yeah. Prime Minister.
I thank the honourable gentleman. And of course, one of the problems is that Northern Ireland, places like Strabane, have I think about 820 cases per 100,000, about the highest in the UK, maybe in the whole of Europe. And we have to. That's why we have to take the actions that we are on the circuit breaker. I hear what he says. We want to give these measures time to work if we possibly can.
Mr. Speaker, and can I thank the Prime Minister for his welcome statement today. I've been visiting pubs and event businesses in Meon Valley where our COVID transmission rate is below the national average. What reassurance can he give to businesses which are looking to plan ahead that restrictions will be lifted flexibly where transmissions revert to a low level?
Prime Minister.
I can give her every possible assurance that as soon as transmission is obviously down, as soon as you've got the R down below 1, Mr. Speaker, things will change very much indeed.
Andy Carter.
Thank you, Mr. Speaker. And can I thank the Prime Minister and his team for engaging across the weekend and for the decision to place Warrington into Tier 2 rather than including it in the wider Merseyside region. One of the many questions I'm asked by businesses, particularly in the hospitality sector, is what's the criteria for moving Warrington back into Tier 1 and reducing the level of restrictions locally?
Prime Minister.
Mr. Speaker, it's a very good question. And a lot of people say, what are the precise criteria? That we look at a number of different measures. We look at the hospital admissions. We look at the rate of transmission in the community, and a number of things are taken into account. But one thing clearly that was particularly influential in the decision on Merseyside was the transmission, as has just been mentioned, into the over 60s group, and that's obviously very concerning. When the R, as I said just now to my honourable friend from Meon Valley, when the R comes down, then that changes it.
We are going up to Greater Manchester with Barbara Keeley. Barbara Keeley.
Thank you, Mr. Speaker. Under the initial furlough scheme, staff had 80% of their salary paid if there was no work for them. But the Chancellor's new scheme pays only 2/3 of wages, which for minimum wage staff can be as little as £5.80 an hour. And only those businesses forced to close will get support, even though supply chain businesses will also be hit. If we are going to beat this virus, we need a full package of financial support in all Tier 2 and 3 areas, which pays everyone affected at 80% of their wages. Can the Prime Minister commit to providing that support?
Prime Minister.
Mr. Speaker, I'm proud of this government's record in raising the living wage by record sums, and she will have heard what I've said earlier on this afternoon about continuing with our support for universal credit for the whole of this financial year. Continue with the uplift in universal credit, Mr. Speaker.
Dean Russell.
Mr. Speaker, whilst volunteering at Watford General Hospital just this morning, where it happens to be Think Clean Week, the wonderful specialist infection prevention and control support worker, Cheryl Atkins, used an ultraviolet system to show me how easily the virus, or any virus, can spread through poor hand hygiene. So would the Prime Minister agree with me that it is upon us all to fight COVID by washing our hands regularly and by following the incredibly simple yet tremendously powerful guidance of hands, face, space?
Indeed, Mr. Speaker, I agree with him totally, and it should be Think Clean Week in Watford and across the whole of the UK.
Paula Barker.
Thank you, Mr. Deputy Speaker. Today, the Government has placed Merseyside into Tier 3 lockdown. For 10 long years, my city has been under the boot of Tory austerity, and now the Prime Minister intends to shut down our economy whilst keeping furlough support at 67%, which has all the hallmarks of once again placing our city into a state of managed decline. Will he listen to our Metro Mayor, our City Mayor and local MPs, stump up the cash for a furlough scheme based on 80% of wages without the reliance, as he keeps saying in the chamber today, on universal credit? If it was the right thing to do in March, it is the right thing to do now.
Well, Mr. Speaker, I'm grateful to Steve Rotherham and other leaders in that area for the support that they're giving for the measures that we're putting in place, and I think that they understand the real dilemma that we face, and that is we must get the virus down, but we must also keep the economy going and support jobs, and that's what we're doing.
Ben Bradley.
It's really frustrating, Mr Deputy Speaker, that Mansfield is heading into new restrictions when our rate of transmission is 10% of that of Nottingham City, despite being further away from the city than Derby, for example, which is not being similarly restricted. I understand the need to get ahead of the virus, but I argued strongly against these arbitrary-seeming boundaries. Can my right honourable friend assure me this will be regularly and properly reviewed and that Mansfield won't be automatically tied to the city's fate when it comes to removing these restrictions in the future?
Well, I understand completely the frustrations of the people of Mansfield, Mr. Speaker, and but I'm afraid that further restrictions are necessary across the country in the way that we've outlined today, but of course they will be reviewed very regularly.
Mike Amesbury.
Thank you, Mr. Deputy Speaker. The Halton part of my constituency in Merseyside has been placed in Tier 3. The Cheshire West and Chester part is in Tier 2. In the Cheshire West and Chester part, we've got the nonsense of the 10 p.m. curfew, which doesn't follow the evidence, which needs to be reviewed and changed. In the Halton part, we've got people who are now required to live on 60% of the minimum, 67% of the minimum wage, which is nowhere near sufficient. Look at this again, Prime Minister. Step up, look at this again.
Well, Mr. Speaker, I'm afraid I must reject what the honourable gentleman says, in the sense that I think he's being inconsistent or trying to have it both ways. Most people, I think, in this country want to see restrictions that get the virus down, and that's what we're bringing forward, and that's what we're supporting. And I think most people in this country also want to see support for people who are put out of business through no fault of their own, and that's what we're also providing.
Elliot Colburn.
Thank you, Mr Deputy Speaker. And Carshalton and Wallington residents have worked hard to keep the virus rate down to one of the lowest levels in London. However, with varying degrees of guidance and restrictions across the country, sometimes the guidance can be difficult to follow and people need clarification. So therefore, can my right honourable friend assure me that this new COVID 3-level alert system will make it easier for people to understand but ultimately follow the guidance?
Yes, indeed, Mr. Speaker. That's why we've gone for the 3-tier approach, and anybody in any doubt, whatever, whether in Carshot, I thank his constituencies for the efforts that they've made, but anybody in any doubt should get onto our website, get onto the Gov UK website and see what they need to do to comply.
Rachel Hopkins.
Thank you, Mr Deputy Speaker. Many of my constituents in Luton South work at Luton Airport, its supply chain and linked businesses, such as Theobald's Coaches, who I visited last Friday. While businesses in Tier 3 who are forced to close will be offered some government support, can I ask the Prime Minister what support will be offered to those businesses in tourism, airports, who aren't in Tier 3 but are so distinctly impacted by the additional Tier 3 and they're struggling due to lack of consumer confidence?
Prime Minister.
Well, she makes a very important point, but the businesses that some of the businesses that she talked about, aviation, for instance, we have packages for those, whether through time to pay or through the Birch process. We're trying to look after the aviation sector, but for all businesses that are unable to trade as normal, the joint support system is there.
James Daly.
Thank you very much, Mr Deputy Speaker. Pubs, restaurants and cafes in Bury, Ramsbottom and Tuttington have invested heavily to create COVID-secure environments And this is reflected in the fact that on the last figures I have, in the last 14 days, there are no recorded COVID outbreaks in such places, and there is no evidence at all of significant transmission of COVID in these important community assets. Will the Prime Minister therefore join me in thanking local business owners for their efforts in creating such secure environments, and agree that we should do everything possible to ask local residents, within reason and abiding by government guidance, to support these important hospitality venues and community assets?
Prime Minister.
Yes, indeed, Mr. Speaker. I thank the people of Bury, and of course I'm sorry for all the privations that are being endured, not just in Bury but across the country, and that the best way to get the businesses he talks about back on their feet is for us all, as I say, to follow the guidance, get the R down and take the country forward.
Video link.
Mr. Deputy Speaker, I've listened to the Prime Minister this afternoon, but the reality remains, if the government does not quickly set out much more comprehensive support for places like Bradford, where local restrictions are having a disastrous impact on our businesses and communities, many jobs will be lost in our local economy and businesses will go to the wall. Will the Prime Minister guarantee that every area gets the support that it needs, and will he reopen the discretionary grant scheme so that local authorities like Bradford can respond to the needs of our businesses and communities to protect jobs and livelihoods?
Mr. Speaker, I can tell him that we're supporting local authorities such as Bradford, not just with the £3.6 billion we've already given, but as I said earlier on this afternoon, another £1 billion to come.
Video link. Michael Fabricant.
I thank the Prime Minister for his very clear statement, but compliance is going to be a major issue, even if you do understand the rules. And part of the problem, I think, is that people think that this is just going to go on and on and on for the next decade. So while I understand the Prime Minister's reticence to talk too much about a vaccine, he made that clear in his earlier answer, what help can he give to people in Lichfield and the rest of the country by saying, you know, with new drugs, with vaccines, once we've got over this winter, that'll be it?
Well, Mr. Speaker, I've very little doubt that once we've got through to the spring, we will be in a completely different environment. And I have high hopes that things will change very fast as a result, as he says, of new technologies that are coming on stream. But for the time being, we have to concentrate on the tools that we have in hand, and those tools are the packages of restrictions that we've set out and the basic guidance about restricting contact from person to person and restricting the spread of the virus. That is what we've got to do for the time being.
Video link. Kenny McCaskill.
Thank you, Mr. Speaker. The reality for many in the hospitality sector isn't a close down for a week or two. It's a shutdown for the rest of the winter season. Yet these are businesses that are vibrant and can provide vital jobs when the spring comes around, as they've done in years past, but only if they can survive this closure. When Germany can furlough through until next year, why won't the United Kingdom?
The Chancellor has set out the job support scheme, which, as he said earlier on, goes through till next year.
Andrea Leadsom.
Mr Deputy Speaker, I'm sure that my right honourable friend would agree that to get broad compliance with these very tough lockdown measures, ordinary, sensible working people need to understand that they are fair and logical. So would my right honourable friend agree to publish not just precise details of what the rules are, but also details of why each one is necessary?
Yes, indeed, Mr Speaker.
Sarah Sultana.
Deputy Speaker, key to stopping the spread of the virus is giving people the financial support they need to self-isolate when they need to. But millions of working people still don't have that. The government's test and trace support payment scheme is totally inadequate. Only a small proportion of workers qualify, and even those who do, at £500 for up to 2 weeks, it's less than the minimum wage. So will the Prime Minister finally do as I urged him back at PMQs in March, raise the statutory sick pay to the real living wage, extend it to cover all workers, and give people the financial security they need to self-isolate?
Mr. Speaker, I just remind her that in addition to the £500, there is also the support of universal credit, and to those who are thinking of not isolating still, alas, I must tell the House that there is a fine of £10,000.
Laura Trott.
Thank you, Mr. Deputy Speaker. I was glad to hear the Prime Minister in his opening statement refer to the need to continue with elective operations. My own trust has pledged to continue this through winter for as far as possible. Can he confirm that this decision will continue to be locally led and he will do all he can to prevent a backlog?
Prime Minister.
Yes, Mr. Speaker, and it's exactly in order to prevent a further backlog that we need to prevent an uncontained outbreak of coronavirus now. That's why we're putting the measures we are.
Mary Rimmer.
Thank you, Mr. Deputy Speaker. Prime Minister, you should have no problem in giving me a positive answer to my question now. For lockdown restrictions to work, the public support is essential. We know that. To give up what they enjoy most, people need to understand why. Will you, Prime Minister, commit to sharing the evidence with the public about why specific businesses types have been forced to close?
I repeat the undertaking I already gave earlier just now.
Video link. Alicia Cairns.
Thank you, Mr. Deputy Speaker. I thank the Prime Minister for his support for my campaign to ensure all women have partners with them for all scans and all labour. But can he confirm whether pregnant women in their third trimester should be shielding across the country given their much higher vulnerability to COVID, and that employers should recognise this and support them to work from home or in roles that aren't on the front line?
Women in any doubt about what they should do to shield from COVID should get onto our website, pregnant women that is, and consult the gov.uk website for advice, because there's plenty there for pregnancies.
Maria Eagle.
Thank you, Mr. Deputy Speaker. I understand and agree with the need to prevent households mixing to cut COVID rates on Merseyside. But this tough local lockdown is going to destroy many businesses and jobs that won't be eligible for the limited local furlough so far announced by the Chancellor, because they won't be forced to close by law. They'll just lose most of their business. So can the Prime Minister undertake to look again with his Chancellor at the business support scheme with the aim of ensuring that jobs and businesses can survive this tough next 6 months and be able to grow again in better times, rather than have to close now with all the misery, unemployment and bankruptcy that's going to result?
Minister.
Well, I think, and of course, in addition to the billions that we've invested in CBILS, coronavirus business interruption loans, 19 billion in those to SMEs, 38 billion in bounce back loans, and so on, all of which are still available. We're making cash grants for businesses that are such as in Merseyside, that face these local lockdowns, that have been forced to close as a result of these local lockdowns, of up to £3,000.
Steve Bryan.
Thank you, Mr. Deputy Speaker. I very much welcome the Prime Minister's view today that a second national lockdown is not the right course for our country. As well as kicking the can down the road, it would be totally unfair on areas such as I represent, which for all manner of reasons, and there are many, have a completely different rate. But given we very obviously have a north-south split in our country right now, and there's no judgment or blame in that, and there shouldn't be, it's just a very stark fact. Can the Prime Minister tell us his opinion, and indeed what explanation he's been given by the experts as to why?
Mr. Speaker, the reality is that the disease is rising across the country. We've seen in other European countries and around the world that it sometimes rises fastest in one place rather than another. The sensible thing is to tackle it in a local way, and that's what we're doing.
Evan Brennan.
Thank you. 89% of positive cases were reached between September the 27th and October the 3rd by local authority public health tracing in Wales, but just 74% for the equivalent period by the outsourced centralised system in England. Now, that's not ideology, that's just better virus control policy in order to save lives. You need trust to be effective with test and trace. Does he now acknowledge that outsourcing the system was an error?
No, any more than getting a vaccine from the private sector or a test device from the private sector is an error. You need a mixture of public and private. You need a mixture of national and local, and that's what we're doing.
McCartney.
Thank you, Mr. Deputy Speaker. My Colne Valley constituency, as part of the Kirklees East Council area, as part of West Yorkshire, is going into Tier 2 of these COVID-level restrictions. Can the Prime Minister please tell me and my constituents that are we now tied to the fortunes of West Yorkshire as a whole, or can smaller, more localised geographical areas, as people make local sacrifices, move out of these tiers as we move forward?
Well, I appreciate the sacrifice that his constituents have been making. I'm sorry for the privations that are being visited on people across the country to see exactly where you are and what you need to do. Get on the website, and as soon as we can take areas out of the measures that they're in, of course we'll do so.
Video link. Bill Esterson.
Without evidence, people won't have confidence in the government. So what is the scientific evidence for the restrictions he announced, which affect 1.5 million people in the Liverpool City region? People need hope that these measures will be short-lived. So what is the exit strategy? And specifically, what will the infection rate have to fall to for the restrictions in the Liverpool City region to be lifted?
Well, clearly, Mr. Speaker, the most important thing is that the R should get below 1.
Dr. Andrew Morrison.
Seasonal flu deaths for the past 2 years have been relatively light, which means in the normal course of things we would expect a hard winter, noting that in 14-15 there were 26,000 deaths and in 17-18, 28,000. Now, I appreciate the government is doing everything it can to increase the number of vaccinations, but given that we can vaccinate against this disease, unlike COVID, will the Prime Minister redouble his efforts to make sure that those who are vulnerable this winter get the flu vaccine they need?
My right honourable friend is entirely right. That's why I encourage everybody who is vulnerable to get a flu vaccine now, and that's why we've got 30 million available.
Emma Hardy.
Thank you, Mr. Deputy Speaker. Today we had a Yorkshire briefing with 15 minutes notice that failed to invite all Yorkshire MPs, and nor have all Yorkshire Council leaders been contacted. We're left waiting for the Prime Minister's website update to find out which tier we're in. This shambles is creating confusion and fear, and we need clarity. So will decisions about Hull and East Riding be made together, as part of Yorkshire, separately, or as part of Yorkshire and the Humber? And how much notice to changes will we get?
Well, I can tell the honourable lady that we've been, the government at all levels has been in constant contact with authorities in Yorkshire for the last few days, and I'm very grateful for their cooperation.
Mr. Deputy Speaker, can I recognise the Prime Minister's focus and statement in introducing a much more simplified restriction regime, which offers greater clarity and strikes a balance between the risk of spreading the virus and economic activity. But can he tell us what discussions have taken place with the devolved administrations to have a uniform approach across the United Kingdom? And is he able to update us whether the Leader of the Opposition has supported such activity in engaging with the Welsh Government to encourage them to follow suit? Because this will have a major effect on the Treasury support and the simplicity that businesses in my constituency can draw on.
Well, Mr. Speaker, it's certainly the case that there's a wide measure of cooperation across all the devolved administrations and with the government, and it is also the case that to the best of my knowledge, the Leader of the Opposition has at least sometimes backed the restrictions, and I hope very much that we will continue to work in that collaborative way, Mr. Speaker.
Video link. Ruth Edwards.
Thank you, Mr Deputy Speaker. The measures my right honourable friend has announced today are sadly necessary given the sharp rise in cases. But hospitality businesses in Rushcliffe, like the fantastic community-owned Air Hostess pub in Tollerton, which I visited last week, are understandably worried about the impact that stopping households mixing will have on their business, just as they've got back on their feet. Can my right honourable friend confirm how often Tier 2 measures will be reviewed? And can he assure me that they will only be kept in place in Rushcliffe until infection levels have decreased in the borough?
I understand her anxieties and the anxieties of the people of Rushcliffe, and we will keep all restrictions under constant review in order to remove them as soon as we possibly can.
Thank you very much indeed, Mr Deputy Speaker. It's quite clear that as we move into further restrictions with the virus increasing, that we're not going to go back to live music anytime soon. My Belvedere constituent, Craig Johnson, came to see me at my surgery on Friday and is concerned about the lack of support for people in the live music industry. What's the Prime Minister going to do for Craig?
He's right to raise that issue, and that's why we've put £1.57 billion into supporting the arts, and that funding covers also freelancers, people who are involved in the live music industry as well. But the best thing for them is to get those types of events back up and running as fast as possible.
Mr Deputy Speaker, I would just like to tackle a misnomer, if I may. Isn't it because this Conservative government respects personal freedoms that these difficult but pragmatic measures are necessary in the short term to keep people safe?
It is indeed, Mr Speaker, because people should have the freedom from fear, the freedom from seeing their jobs destroyed in the long term, and they should have the freedom to go about their lives in the normal way. And the only way to restore those freedoms to this country is for us all to follow the guidance, get through this thing in the way that we're doing, and get back to normal as fast as possible.
Video link. Sian Warra.
Thank you, Mr Speaker. Test, track and isolate must be made to work. Without it, nothing can work. Can the Prime Minister tell me where transmission is occurring in Newcastle now, rather than guessing based on US data? And if he cannot, after 6 months and hundreds of millions of pounds spent on private contractors to track transmission, will he accept that fundamentally what is not working in this pandemic is the Prime Minister, and the businesses and people of Newcastle are paying the price?
Mr Speaker, it's thanks to the great expansion of NHS test and trace that we do know where the virus is being transmitted in this country. We do know where the incidence is rising, and we know it with, contrary to what she says, we know it with increasing and granular detail, and that enables us to take the local measures that we're taking. I hope very much, I can take it from what she's just said, that she supports those measures in Newcastle and in the North East.
Aaron Bell.
Thank you, Mr Deputy Speaker. Does my right honourable friend agree that we need a flexible local approach to tackle outbreaks? And does he also agree that authorities containing a university, such as Newcastle under Lyme, should be able to take into account the distinct nature of outbreaks at universities when we look at which tiers we move into, rather than relying on a single catch-all case rate?
Indeed, Mr Speaker, but I'm, as I said earlier, I'm reluctant to make a hard and fast distinction between students and other members of the population. They're heir to the same afflictions as the rest of us, and by and large I think students are doing a great job in following the guidance, and we'd encourage all of them to do the same.
McFadden.
Mr Deputy Speaker, whatever new restrictions are introduced in each of these 3 tiers that the Prime Minister has announced today, it's essential that we do everything we can to keep children at school and keep children learning. Now, with that in mind, will the Prime Minister ensure that where a positive case is identified in a school, the smallest possible number of children are sent home, rather than, as is sometimes the case at present, a whole year group? And will he do that to ensure that children's long-term opportunities are not damaged, that inequality does not further rise, and that children's education is not hurt even more by the necessary fight against this virus?
Well, Mr. Speaker, he's raising an exceptionally important point, and a great deal of work at the moment is going on into the right size of the bubble, as it were, and how many infections should be decisive in taking action in schools. But I'm very happy that to say that at the moment, at least, we've got almost 90% of kids in school, and 99% or 99.9% of schools open, and that's a great achievement by teachers, parents and pupils alike.
The Villiers.
The furlough and self-employed schemes have provided crucial help to many millions of people, but unfortunately there are around 3 million who fell outside the scope of those schemes. So can I appeal for help for those groups like the newly employed, newly self-employed, directors of limited companies and freelancers on short-term contracts, because some of them are suffering real hardship?
Indeed, Mr. Speaker, and I've mentioned the 13.5 billion that we've already given to the self-employed, and she understands the difficulties of the cut-off date that my honourable friend the Chancellor has illustrated. But it's to help people across the country that we're putting in we put in the increase in universal credit, for instance, which will continue for the whole of this financial year.
Video link. Tony Lloyd.
Thank you, Mr. Deputy Speaker. The Prime Minister knows that the control mechanisms introduced in Greater Manchester can only work if we have an efficient test, track and trace system. He told the House earlier on that he aims by the end of this month to have 500,000 tests completed on a daily basis. Can he make it clear, though, that track and trace only works if those tests deliver results very, very quickly? And when will we get to the point when those 500,000 tests will be reported back reasonably, and in most cases within a day?
Mr. Speaker, what I can tell him is that we're turning around tests as fast as we possibly can, and laying on new labs, new test sites, and I'm very confident that we'll get up to 500,000 tests a day by the end of the month. I'm not going to make a commitment now about turnaround times, but his point is well made.
Andrew Griffith.
Thank you, Mr. Deputy Speaker. During a pandemic, life and love continues. I know that my right honourable friend, the Prime Minister, has strained every sinew to protect people's lives and liberty. But would he undertake to review over time the guidelines that say a venue that could seat 200 as a restaurant could only seat 15 if that happens to be a marriage ceremony?
Mr. Speaker, my honourable friend, like many honourable members across the House, draws attention to what appears to be an anomaly in the regulations and in the guidelines, and there are many such issues that we're doing our best to iron out. But when you're dealing with a pandemic like this, and when your only tool of influencing human behaviour is guidance, I'm afraid such anomalies inevitably arise, and we'll do whatever we can to iron out any inconsistencies there may be.
Comments.
Thank you, Mr. Deputy Speaker. In areas like Bradford, which have had local restrictions since July, people living in care homes have gone months without face-to-face contact with loved ones. For people with dementia, a lack of social contact can cause a marked decline. Will the Prime Minister commit to doing everything he can to keep care home residents safe, but also to work to reintroduce visits, for example by testing loved ones on a regular basis? And can he confirm whether there will be changes to the shielding guidance in Tier 2 or Tier 3 areas?
Prime Minister.
Mr. Speaker, on the guidance for Tier 2 and Tier 3 areas, the best thing that residents of those areas can do is get on the website and check exactly what is needed. But she makes a very important point about care homes, and I think the whole House feels for those who are in care homes, perhaps nearing the end of their lives, worried that they may not see their loved ones. It is a truly terrible situation. No one would want to do that lightly. We try to make exceptions for very, very difficult circumstances, but we must reduce the incidence in care homes, or we must keep it as low as we've got it. We saw what happened earlier in this year, and I'm afraid we really don't want to see a repeat of that.
Ian Smith.
There's been really positive engagement between Number 10, the government and local authorities in the north of England over this weekend. Can I support calls for local authorities to do more on track and trace and on this issue of care home visitor access? Would the Prime Minister keep encouraging his teams to look at creative solutions between local authorities and government and how we allow loved ones to visit their sick and elderly relatives?
Yes, indeed, Mr. Speaker, and I think creative solutions are in order on that. I thank my on that very important matter, and I think we really have to go the extra mile in such difficult cases and see what kind of maximum protection we can offer loved ones who need to visit their elderly relatives in very difficult circumstances.
Julie Elliott.
Thank you, Mr. Deputy Speaker. Sunderland, along with a lot of the North East, went into local measures a few weeks ago, and there were a number of asks of government. Some 14 million for test and trace, and also some 24 million was asked for business support. There's been no response one way or the other in it's now almost 4 weeks. Could the Prime Minister commit to look into what the logjam is and get a response quickly to our local authorities, because they need to know what is happening?
Absolutely, I will, Mr. Speaker. She'll have heard what I said earlier on about the support for local authorities, but I'll make sure that we look particularly into what's happening in Sunderland and get her an answer.
Imran Ahmed Khan.
As Conservatives, we often speak of levelling up. However, now is the time to level with the British people. There is no silver bullet. All measures to stop the spread of COVID have painful effects on our economy, social lives, and mental well-being. Voices on the benches opposite believe that British people are incapable of understanding complex issues like Brexit. The Conservative Party is the champion of individuals' rights to make autonomous decisions without state interference. Will the Prime Minister double down on our party's historic commitment to invest greater trust in the individual to decide what is best for themselves?
Indeed, Mr. Speaker, and I hope that the individual will also recognise that the risk that we carry, he or she carries, is not just for ourselves. It's not just for ourselves, but it is a risk for the whole of the community, because in the end we're all potential vectors of this disease, and we may bring it inadvertently to someone who is less vulnerable than ourselves, and that is the risk, and that's why we're bringing in the measure. That's why we've had the package of measures throughout this pandemic that we have, and that's why we need to intensify them in some local areas now.
Brabham.
Thank you, Mr. Deputy Speaker. Just to follow up on the question from my fellow Kirklees MP, the member for Colne Valley, can the Prime Minister clarify, is it possible for local authorities or areas within local authorities, if the numbers are right and they're going in the right direction, to come out of these restrictions if numbers allow and it's safe, even if the wider region cannot?
Well, of course, we keep all this under review, but as I've said, I think several times, throughout the afternoon, you have to keep your geographical area fairly coherent. And I know that causes a great deal of frustration with honourable members, and I've been hearing it for weeks and months. But that's the way we've got to do it.
Mr. Deputy Speaker, I was down as number 116 on the list today, so can I thank the Prime Minister for answering so many questions in the Chamber today. Regulatory impact assessments are pesky little things, but they're absolutely vital in assessing the impact of regulation on the community and particularly on small business. So can my honourable friend commit that he'll ask his Cabinet colleagues to prepare regulatory impact assessments for the three-tier approach, have them scored by the Regulatory Policy Committee and laid before the House of Commons within the next 30 days?
Well, I share my honourable friend's general hostility to unnecessary regulation of any kind. And believe me, it hurts to do a lot of the things we've had to do over the last few months. But I see no reason at all why we shouldn't conduct, without being too bureaucratic about it, why we shouldn't conduct an assessment of the implications of these measures as well.
Video link. Richard Thompson.
Thank you, Mr. Deputy Speaker. Last week, prompted by data and scientific advice, the Scottish Government acted to introduce new restrictions to halt the spread of the virus, measures which were criticised at the time by Scottish Conservative politicians, but which the Prime Minister has largely followed this afternoon. It's vital that businesses and individuals get the financial support they need through this crisis. In that case, why won't the Prime Minister match the public health powers that the devolved governments already have with the financial powers which would allow them to do whatever it takes whenever it's necessary to support businesses and individuals, instead of always having to hope that eventually his government will catch up?
Well, Mr. Speaker, as the honourable gentleman knows, it's one of the features of this crisis that the UK Treasury has been able to step up to the plate and support people throughout the United Kingdom. That is going to be our approach throughout, and I'm grateful also for the close harmony which he, in our approach to which he alluded earlier.
William Ragg.
Mr. Deputy Speaker, and I do fear that talk of closing hospitality venues such as pubs, restaurants and cafes misses the point, given the very limited transmission of COVID within them. For example, this has averaged just 2.4% in Stockport over the last 4 months. Is not the danger in closing them that people will meet in each other's homes where transmission is much higher rather than these COVID-secure venues?
As he knows, in areas, in level 2 areas, and indeed by a fortiori in level 3 areas, there are restrictions on household contact which are designed to bring down that transmission. You should not meet other households indoors, either in a domestic or in a hospitality setting.
Munira Wilson.
Thank you, Mr. Deputy Speaker. The latest technical glitch in the Prime Minister's so-called world-beating test and trace system, which has been dubbed a data enrichment process, has meant that many positive cases of students have been automatically attributed to their home address instead of their university address. This has affected about a quarter of new cases in Richmond-upon-Thames, in my constituency, and has been replicated in Cambridgeshire, in Cumbria, Hertfordshire, Essex and elsewhere. So how can quick and effective local tracing take place if cases are being reported to the wrong place, and how might this affect decisions around which tier areas are placed into?
Well, she makes an important point, but with respect to the honourable lady, we're aware of that phenomenon of data showing up where students are registered with their, or anybody's registered with their GP, rather than where the transmission is taking place, and so we obviously aim off for that.
Final question. Jacob Young.
Thank you, Mr. Deputy Speaker. The Health Secretary has confirmed that parts of Teesside, including my constituency in Redcar and Cleveland, will also be entering into Tier 2 restrictions from Wednesday. I desperately wish these restrictions weren't necessary, as these will understandably have a great strain on the mental health of my constituents, who will now be limited in their interactions with their friends, families and partners. Can my right honourable friend assure me that the people of Redcar and Cleveland, who put their trust in our party for the first time in December, are at the forefront of his mind, and that we will lift these restrictions at the very earliest opportunity?
Mr. Speaker, I share my honourable friend's views entirely, and I desperately wish that these measures weren't necessary, and the better and in a more united way we can enforce them, the faster we'll be able to lift them. And throughout the country, in Redcar, across the country, we'll be able to get on with our agenda of uniting and levelling up, which, by the way, we haven't forgotten, and we're continuing to do irrespective of this crisis, Mr. Speaker, as I think the people of Redcar would expect.
I'd like to thank the Prime Minister for his statement today, answering well over 100 questions in over 2 hours, and I'm grateful for those who've participated, and there will be many other MPs who would have loved to have got on the call list. We suspend this session for 3 minutes. Order!